Basically, when we talk about conventional therapy or standard therapy, this is the scientifically proven therapies on oncology, and in essence, this is Western practice, and it includes, like Dr. Abdi Hakim has said, it includes surgery, chemotherapy, radiotherapy, immunotherapy, targeted therapy, and what he has already expounded on is how this keeps evolving with time. If you just look at surgery as a conventional therapy, if you look at breast cancer, before we were doing very radical mutilating breast surgeries, and then over time we've come to understand that breast cancer is not just a local disease, it's a systemic disease. So, and exploring techniques such as breast conserving therapy where you just remove the lump, and it's exactly what you cure them or it will relieve their adverse effects from standard therapies. And we have this new term called integrative oncology where they use a combination of both. So why do you need to know about this? You need to know about this because a large percentage of your patients are using them, whether it's in oncology, whether it's in maternity. I was an intern at CPGH, and by the time a mother is in labor, she's already gone through her traditional birth attendant, she's already been given herbs, she's already had massage. So some of the adverse outcomes could be because of some of these prior treatments. So it's not just in oncology, it's in all of the fields of medicine. So a large percentage of patients are using them, and our patients actually ask opinions about them. So as soon as you tell them you need chemotherapy, the next thing is like, can I use this diet? Can I use this herb? Will this help me? Will this, so almost always they will ask your opinion about them. So the more informed you are about them, the better it is for you. In certain situations, they are beneficial. But the side effect to that is that sometimes they delay the early diagnosis, and sometimes they delay start of definitive therapies, resulting in worse outcomes. And many times they interfere with conventional therapies. So the clinical pharmacist has talked about drug-drug interactions. Those are the drugs you know. What about these other drugs that the patient is using that you don't know about? So you have adverse effects. As an example, we recently had a patient with a brain tumor, and she'd started chemo and radiation, and she finished that, and then she was on her adjuvant treatment, and we are monitoring her liver function test because we know our drug can cause liver toxicity, which is temozolomide. And then, so we are doing the LFTs every month, then all of a sudden, her alkaline phosphatase and her gamma GT is going up, and she's been on this drug for about 4 months, and she's been okay. So we just ask her, are you taking any other drugs? Then she says, yeah, I'm taking this herbal tea because when they have brain tumors, we give them a lot of steroids, so they gain a lot of weight. So she was using this herbal tea to try and lose weight, but it was affecting her liver function test. And as soon as she stopped that, the liver functions went to normal. So these are real things that happen with our patients. They also, so I've talked about adverse effects. So those are the drug lab parameter effects that the pharmacist, I've learned something today, drug lab parameter side effects. And then they can also cause organ damage. We've had patients coming in with renal failure, with hepatic failure, and it's mainly because of non-conventional therapies that they've been using. And it's not a problem in Kenya, it's a global problem. So if you look at this is a survey done by the American Society for Clinical Oncology, and they found that up to 40% of Americans believe that cancer can be solely treated through alternative therapy such as enzyme and oxygen therapy, diet, vitamins, and minerals. And even those who have had cancer and have gone through conventional therapies, they still think that those therapies are going to cure the cancer and not conventional therapies. And more importantly, this is for, you would think that the older patients would be the ones who would think about complementary therapies, but actually they found that the patients who use complementary therapies were younger, they were better educated, they had a higher socioeconomic status, they were likely to be female. So it's not just about the people in our community in the rural setup, but even in the Western culture, the use of complementary and alternative therapies is very high. So this is just to illustrate to you what I was talking about, poorer outcomes. So this was a study that was published last year, and they looked at about 700 patients, and they compared those who used complementary or who used alternative therapies and those who went on to have complementary therapies. And if you can see with the Kaplan-Meier curves, so chance of mortality as compared to those who use standard therapies. So the thing about worse outcomes is proven scientifically that if you use alternative medicine alone, you'll have a higher chance of dying. And this risk is for most cancers. Here in this panel showing you about breast cancer patients. And then if you look at prostate, the difference is not so much, because prostate cancer tends to be more of a chronic disease, and the mortality, I mean, they don't die immediately they're diagnosed. It takes them years and years before they die. So the difference is not so much. But look at lung cancer, which already has a high mortality, but this is made worse by just using alternative therapy. And this depicts colon cancer, where you see the same kind of worse outcomes. So this is actually, now we have this data to show that if you use alternative medicine alone in oncology, you're more likely to have a worse outcome. And this was a study that was done in Malaysia, and it basically showed that the use of complementary and alternative therapies delayed presentation to hospital, delayed diagnosis by about 40%, and delayed treatment by about 35%. So it affects not just mortality, but time to presentation, time to diagnosis, and time to treatment. So why do people use complementary or alternative therapies? Mainly to improve wellness, to improve quality of life, to relieve symptoms of the disease, and relieving side effects of conventional therapies. But we know that the benefit for their tumor or their cancer is minimal. And so what are the examples? So we have traditional healers, we have Ayurvedic medicine, which is based on Indian practices. We have traditional Chinese medicine, which is very popular in Kenya. So things like acupuncture, Tai Chi, Qigong, and herbs. And then we have homeopathy, which basically operates on two principles that like cures like. So if you have a viral infection, go to someone who has a viral infection to, And then law of minimum dose, which means that you have an active agent that is diluted to such an extent that it reduces the side effect. And then you have naturopathy, which is a combination of almost all these things, and something called functional medicine. And then, in Islam, we have prophetic or Islamic medicine. And so this was a very good quote from Kitab al-Tib, which is a very important book, I think, for all clinicians to read, because it has lots of words of wisdom. But I put this here just to say that our Prophet ﷺ was not averse to medical therapies, and actually encouraged people to go for conventional treatments, and said, make use of medical treatment, for Allah has not made a disease without appointing a remedy for it, with the exception of one disease, which is old age. So he wasn't averse to people seeking medical treatments. And then prophetic medicine are actions done and thought said by the Prophet Muhammad ﷺ with regards to sickness, treatment, and nutrition. And they actually cover a lot of things. We're talking about preventive health, such as cleanliness, diet, and staying fit, and foods with benefits in relieving symptoms, and recitation of du'as and Quranic verses. And Islamic medicine is broader than that, which encompasses a variety of practices from ancient Muslim civilizations. So even within Islam, we have our own medicinal practices. So what are the commonly used complementary therapies? So natural products such as herbs, vitamins, minerals, and probiotics, deep breathing. So this is American data. So in Kenya, 75% of the complementary therapies is herbs, vitamins, diets, and minerals. And then you have things like yoga, meditation, massage, special diets, and guided imagery. So in Kenya, FYI, there are 40,000 traditional healers, which are more than the number of physicians. We have about 8,000 physicians in Kenya. And these include herbalists, bath attendants, bone setters. You know, bone setters, the ones who throw the bones. And then faith healers. This was data from 2011. And 2 out of 3 Kenyans will depend on traditional medicine for primary health needs. So even if you're talking about universal health care, you need to know that a lot of that is being done in the community by traditional healers. And then we have an estimated 264 plant species which are used by herbalists. But importantly, a lot of the drugs we're using are actually derived from plants. So things like quinine, aspirin, digitalis, artemether. A lot of chemotherapy drugs are plant-based, like paclitaxel, docetaxel. A lot of them are like antibiotics, like doxorubicin. So it's not that these things are not useful, it's that they're not clinically tested. So, and the evolution is that now we have the traditional medicine is under the Ministry of Health. So we are all under the same regulation, but the only problem is that we are regulated and they're not. So that's the only difference. But there's been a push to regulate them, and in putting them under the Health Act is one of the ways of starting that process. The challenges of them is that we have lack of well-conducted research, and then we have these sensational headlines that are in the media that are not reflected in journal articles, and that they are steeped in tradition, which is difficult to break, and there's a lot of stigma because with association with witchcraft. So what is exciting was in 2017, KAMMP had a conference where they gave data on about 20 plants that they're looking at in different cancer cell lines. So this is a step in the right direction in terms of you're using this herb, does it actually work, yes or no? So putting it through that scientific process that we talked about. And then the common myths with relation to cancer usually are around diet. So things when they start cancer treatment, they go off meat, they go off milk. They remove so many things from their diet in the hope that this will treat their cancer. And sometimes it has adverse effects on them. None of these things have been associated to cancer or improving cancer. So if you look at what are the things that help, so these things do not help with the cancer, but they help to relieve symptoms such as nausea and vomiting, fatigue, depression, low mood, but they don't actually improve your outcome from your cancer. So things that have been studied and shown to be beneficial in these side effects are things like acupressure, acupuncture, yoga. Ginger is very good for nausea and vomiting. And then there's a very topical thing about marijuana or weed is that it actually helps with chemotherapy-induced nausea and vomiting. It helps to improve appetite. It helps with neuropathic pain. But so far, there's no evidence that it actually improves cancer. Things that are questionable, soya, laser therapy, and then what we commonly see in our society, moringa, does cupping help? That is questionable. So in conclusion, a large percentage of our patients are on complementary or alternative therapy. So you need to ask them when you're taking history, are you taking anything? Are you doing anything else? Because it will have an impact on their outcome, and it might have effects on the standard therapies, and it may help with general well-being. And I think the fact that there's research in the region is encouraging, and we might get more answers in due course. Thank you for your attention.
Thank you very much, Dr. Sitna. It was an elegant presentation, and I always say that experience is a good teacher. Her topic reminds me of Professor Abdullah, which we will discuss during the Q&A, inshallah. With that, I would like to welcome our very own from Mombasa, an expert in the field of medical oncology, Dr. Riaz Kasmani, a consultant at Aga Khan Hospital, Mombasa. Please welcome.